There are 20 sexually transmitted diseases. They usually present in one of two ways.
Okay.
And one is a skin lesion on the penis, which is usually an ulcer, and the other would be a discharge. Intimate partners of men and men find more testis cancers than doctors screening them.
So partners notice it.
Absolutely. These guys for 6 months or 8 months finding things in their scrotum the size of their testis, which is very concerning. You could take a circumcision where that foreskin comes off and turn it into a wallet if you rub it. So it's really quite flexible and stretchable. And then another thing you can have on the bottom of the penis in this area, which is the G spot for men. In that area,
Hold on. We can't just gloss over that.
men will have sex, maybe unprotected, and then they'll really look at their penis closely and they'll come in because they find all of these things. And I'll just say it's fine, it's not an STD.
I'm feeling really good about the look of my penis right now. Hello, everybody, and welcome to another episode of Talk With Turek. It is a podcast about men's fertility and sexual health. My name is Rob Clyde. I'm the everyman on this show, and the guy that plays the doctor is my friend Paul Turek.
Hello, Rob Clyde. Good morning.
Good morning. Paul, you're a reproductive urologist. What does that mean?
Basically, my practice is focused on the reproductive health of men, which is anything down there and anything hormonal. So I usually take care of men from sort of 18 to 60s for benign conditions and keep them empowered.
Love it. And today we're going to be talking about lumps and bumps down there, which we're going to be talking a lot about our scrotum, our penis, and any kind of abnormalities that we might find down there and what they mean and what we should do about it.
There's lots of different lumps and bumps down there. Some good, most okay, some bad.
So if you've ever felt a lump on your testicle or you spotted a bump on your penis and you've gone straight to panic mode, then this is the episode for you.
Yes.
Right? So our goal today is to calm the panic, educate, and describe. We've got a whiteboard here. You're going to do a little drawing. We're going to teach the class today a little bit about...
It's genital anatomy and lumps and bumps 101.
Okay, so where do we start? We're going to start with the skin.
It's not looked at very much when you look at dermatology conditions down there. The field of andrology, which is sperm and reproduction, actually developed in historic times from dermatologists. So mostly in a couple hundred years ago, what they treated men like me or doctors like me would treat is skin conditions like syphilis and things like that. And it's really interesting that a lot of great people have died of syphilis and things that were untreatable. And probably the biggest invention in the modern era to extend our lifespans was antibiotics, which treats a lot of the STDs or STIs, we call them, right? Let's do a little drawing.
Okay. Now we're talking about the skin of the penis right now?
Yeah, we'll do... Okay,
Yeah,
let's start with skin. So there's skin on the scrotum. Like every skin, there's skin on the penis. Interestingly, the skin in the genital areas is very variable. Like the skin on the penis is like eyelid skin.
Yes.
So it's very thin, very little fat, very stretchable.
Okay.
Right. So you could take a circumcision where that foreskin comes off and turn it into a wallet if you rub it. Right. So it's really quite flexible and stretchable.
All right.
And the skin of the scrotum is very unique because it's got oil glands under your arm. So it's got sweat glands and things like that under your arm, and it's very it's compacted. It's got a muscle in it, so it's very thick and also expandable.
Okay.
So it's a very unique part of the body for many reasons. The scrotum has a couple of conditions. Some are inherent, like there's one called sebaceous cyst, where you might have a lump under the skin, which is skin colored, and there could be multiple of them, and they could be about 1 centimeter. And they look concerning, like there's a mass in your scrotum, but they're just blocked hair follicles with sebum in them.
Okay.
And they usually are benign. They're sometimes white. They can get infected, and then they hurt, and then you have to excise them. But some men have multiple, and some people only have one, and some have none. But they are benign.
I mean, pardon me, but it just sounds like a zit.
Sort of, yeah, but bigger.
But bigger, and
hard.
You need to get rid of them.
You don't need to, but if there's
uncomfortable,
multiple, they look
unsightly.
A little unsightly.
Okay.
And they can be excised.
All right. But it's just skin at that point, or just under the skin,
just
hair
under
follicles.
the skin,
There's nothing wrong
blocked.
with my testicles at that point or anything. Okay, cool.
Benign. And then another thing is you can have angiokeratoma, which are just small red dots, typically occurring with age, very, very small. They can bleed if you rub them, or shave them if you're shaving.
Yep.
And those are benign too, but they can come on later and you're wondering what that red dot or purple dot is. This is called angiokeratoma.
Okay.
And those are benign and you wouldn't do anything about those. And then there's other conditions from the rest of the body that occur. One is eczema and one is psoriasis. And those
Sure.
can occur like other parts of the body, your elbows. And, that really needs a dermatologist to figure out, but typically it's treated topically with steroids and things that are topical. So those are general conditions that are benign.
And I would guess like jock itch is similar to the
So
last
jock itch
name?
would be sort of in this crevice here,
Right.
which is typically fungal.
Yep.
And that's because it's moist down there. So typically in the summer, you're exercising a lot.
Yeah.
The distance between the scrotum and the thighs is tight, and it gets wet, and it stays wet. So treat that sort of like diaper rash, clean and dry.
Got it.
So there's, talc is beautiful, but it's kind of not in vogue right now.
In vogue, exactly.
Because of silica. But there are non-talc powders that you can use. I like nystatin, which is an antifungal powder, because it's not just dry, but it also has an antifungal. But that's about keeping it clean and dry. Like after you shower, just keep it really dry. It's like baby skin. Keep it really dry.
So this is stuff on my scrotum. Now what about my penis?
So the penis has a bunch of things too that are a little different than that. It doesn't really have eczema or psoriasis that much, but on the shaft you can find folliculitis, which is just hair follicles that are infected, and they look like a bump and they're concerning. There's usually hair nearby.
Yep.
Again, it's a little sebum. They're not as big as this.
Okay.
And then you can have pearly papules. So around the edges of the corona, which is the crown of the glands here, at the very edge, you can see little pearls, tiny, tiny pearls. And those are benign. Everyone thinks they're growths or they're STDs. They're not.
Okay.
And they're just little tiny growths at the edge of that rim there, and it's called pearly papules. And then another thing you can have on the bottom of the penis, where it comes up and it kind of joins there in this area, which is the G spot for men. In that area, and this is the urethra.
Hold on. We can't just like gloss over that, right?
Run
Like
over that.
so we feel like we know our bodies pretty well, but that's the
So
G
if you
spot.
lift the penis up,
Yes.
and that's the underside of the penis,
Yeah.
where the glands joins the shaft,
Yeah.
and not the urethra is up here where you
Yeah.
pee. That area is the most sensitive part of the penis in general for men.
Got it.
It can be elsewhere on the shaft, and it can be elsewhere there, but there's typically
It's
one
generally
spot.
the spot.
In that spot, at that groove, you can see also little tiny dots that look like the pearly papules, and they're called Fordyce spots.
Okay.
Fordyce spots.
Four dice.
People come to me all the time and say, this cancer, what is this stuff? Because they look really hard at it, and they think it's a wart or something like that.
Yeah.
And it's not.
I'm feeling really good about the look of my penis right now because I haven't seen this stuff on mine, but I can see where if I had little pink dots or little purple dots anywhere, I would call you.
The reason I bring up this whole section is because men will have sex, maybe unprotected, and be worried, and then they'll really look at their penis closely, and they'll come in because they find all of these things. And I'll just say, it's fine, it's not an STD. Now, there are lumps on the shaft, usually at the bottom, which are called HPV or warts, and they're like warts on your hand. It's actually the same virus. And those can occur usually, like if you have a condom, where the condom ends at the base of the penis is where they kind of occur, not normally at the top. But those are kind of, look like broccoli, sort of broccoli with a base on it.
Yep.
And they'll grow, and you'll see that, and that is an STD.
Got it.
But it's a viral STD that everyone has. A lot of people have HPV.
I was going to say this is the HPV, which is very popular in this country.
There's a long history.
Yeah.
HPV, you can have it in the urethra, and that is the stuff that gets into the woman and can give HPV infection to women in the cervix. And so there's several types of HPV. It's human papillomavirus, and some of them are sort of benign, and some types are considered pre-malignant.
Yeah.
It's not malignant for the penis. It's more malignant for the cervix, so cervical cancers. But Gardasil and the HPV vaccines have done an amazing thing, and girls get them, and it's almost prevented cervical cancer later in life. I definitely recommend boys getting it too. One vaccine eliminates cervical cancer. It's crazy.
We talk about this stuff on this show, right? We talk about things that in society they don't want to talk about. And one is talking to our young men about sex and STDs and the things early.
Yeah.
I feel like the HPV vaccine and that whole controversy that people, it's just because they don't want to talk about their kids having sex or something,
Right.
and they just don't want to talk about their kids' genitalia. But you're saying that it prevents cervical cancer in the
huge.
future.
It's
a
huge.
huge
And it's a
game
young woman's
changer.
cancer. It actually is now associated with penile cancer if you're uncircumcised. So we'll get into penile
Okay.
cancer, which
All
is
right.
a scary but rare thing.
Okay, so
So-
continuing down the penis.
Right. So there's molluscum contagiosum. There's some dermatologic conditions like seborrheic things that occur in the penis that are also occur elsewhere in the body. And if you're worried about a bump, like if it's a wart,
Yeah.
which looks sort of like it, it's sort of cauliflower looking, that you need to go to a doctor for this.
Yes.
And dermatologists or urologists are good. Dermatologists know all this stuff because they see it elsewhere in the body.
Yeah.
And so this skin is literally like facial eyelid skin.
Yeah.
It's very different, very
Sensitive.
delicate, and you just watch for change, right? So if something's been there all the time, like a mole can be there,
Sure.
like elsewhere in the body,
Sure.
but it doesn't change. So those are the benign things. Now I'm going to get into the less benign conditions, the more
Okay.
serious
Less benign,
conditions.
more serious conditions. Yes. Okay.
So ulcers are things, and then there's also discharges, right, that
Yeah.
come out of the penis.
yeah.
Right. There are 20 sexually transmitted diseases that you can get in the world.
20. Okay.
And you've got to think about all of these when men come in and say, I have an STD or I have this or that. And most of them of concern, there's about 8 of them
Okay.
that you worry about down here a lot. And maybe 9 or 10 with warts. But they usually present in one of 2 ways.
Okay.
And one is a skin lesion on the penis, which is usually an ulcer. So
Okay.
it's like a caved out area like a crater. And the other would be a discharge, which is not a skin lesion. It's green, yellow discharge from the penis that doesn't look like urine or doesn't look like semen.
And it just discharges on its own in a random, or it's
Sure,
with-
yeah, it can get your underwear all full of stuff. And
and no sexual arousement to do it, or
No.
it just discharges itself, and you're like, what's this in my?
yeah, and
underwear?
it's usually, it usually burns. It's called dysuria, or it usually burns when you pee because
Yeah.
the urethra is inflamed that too.
Got it.
So the skin lesions, basically, there are 5
Yep.
of the 8. The most common is herpes. Herpes simplex type 2, which is a cluster of small pimples, sort of like acne in your face. They have a mound, they have a white tip, and then they break off, and then they have fluid in them, which is very infectious.
Got it.
And they hurt. So
Okay.
pimples that hurt on the penis
That's when you go to the doctor.
is herpes.
Yeah,
right.
It's herpes.
And it comes in, they sort of cluster. And then there's syphilis,
Yep.
which is a painless, shallow ulcer that doesn't hurt, but it sits there. And that's the great imitator. It does lots of things. It goes to your hands. It goes to your foot drop. It causes eye
And how
droop.
does it cause death? Because, like you said, back in the day, before antibiotics, I guess it was
Yes.
killing everybody. And what was the cause of death?
It's complicated. It goes all over the body, and it can affect your brain and your heart,
Ugh.
and it's like a slow, weird, psychotic death.
Okay. Thank God for antibiotics.
Some kings had that.
Oh yeah, that's what I've heard.
And so that's 2.
That's 2.
And then there's chancroid, which is a bacteria, which is a painful ulcer, unlike syphilis,
Okay.
which is not painful. And then there's lymphogranuloma venereum, or LGV, which is a little bit of an ulcer that may go away, and then your lymph nodes get big, and you feel in your groin, you feel pain where you feel there's lymph nodes or glands in your groin that get
Like in
big.
your pelvis,
and they can actually explode, kind of thing.
Jesus.
So these are rarer. And then there's granuloma inguinale, which is another red beefy ulcer, but it's more beefy. So ulcers get looked at right
Yes.
away. Right?
And literally, it's a cave in. It's a bit of a.
It's almost
hollowed
like a
out.
crater,
Okay.
right? There's an edge, a sharp edge, and the bed is, and it's painful or not, and it's beefy or not.
Yep.
And so those need some attention.
So any of these symptoms that Paul just described, if you've got them, give them a call. Let's get to a doctor. This is not going to be fun.
Yeah, and most family doctors and urgent care clinics know about this stuff, but maybe not the harder ones. And then now the discharges, they aren't skin lesions. There's basically 3, and those are the ones that are always checked. So one is gonorrhea, and one is chlamydia, and one is trichomonas.
Okay.
And those trichomonas is sort of a clear discharge. GC, gonorrhea, is sort of green and milky, and chlamydia. And this is more than just spotting your underwear. I mean, this is like coming out.
Oh, it's like a good amount.
Yeah. and it's noticeable and usually pretty symptomatic. Men they feel it too.
Sure.
It's not just coming out.
Okay.
And that's what you normally get tested for if you're getting tested regularly. And those are urine tests. We used to stick swabs in the penis and twist them around.
Are you serious?
Yeah.
People with COVID, like, remember COVID,
Yes.
put it in our nose and how terrible it was?
For 50 years, we were taking brushes and putting them in the
Holy
penis
smokes.
to get those cells. And now there's viral DNA in the urine you can check, and it's pretty sensitive.
Thank God for...
So that's the penis and skin.
Okay, now, we're going to go to lumps and bumps.
So let's go inside now.
Yes.
Okay. Here's the inside.
Yep, that's the testy and the tube, and we've seen this before. That's great.
So testis is here. It's in the middle. The epididymis is a collecting duct around the testicle that matures sperm.
Yep.
And this is the vas deferens, which leads into the groin. And that's where sperm are conducted through. So normally when you ejaculate, there's a pile of sperm sitting in this reservoir here, and it gets pumped out during sex.
Got it.
That's how it works. So the testicle is the only one that has cancer, and we'll talk about that a little bit. The epididymis and the other things, you hardly ever see cancer in the scrotum outside of the testicle.
Okay.
So if it's bad, it's there. But the most common thing are cysts and stuff.
Yes.
And so one cyst is called a hydrocele, which is a fluid around the testis.
Okay.
A lot of organs like the lung have fluid around them for lubrication, for smoothness, so it doesn't hurt. And so there's a fluid layer around the testicle too. It's called a hydrocele, and everyone has one a little bit, but sometimes it gets bigger.
Yeah.
And that's just clear fluid. Hydro means water sac.
Okay.
Right, in Latin.
Right.
And so those aren't pathology really, but if it comes on suddenly, it needs to be looked at because it could reflect a cancer that's irritating, or it could reflect an infection that's irritating the area.
So for me, it all feels just like a testicle, right? You're saying it has the sac and has hydro and all that, but it's just, for me, it's my ball.
So a hydrocele would be...
Is it getting bigger?
Yes. The whole thing feels bigger.
Okay, that's what I'm asking. It's not a bump as much as it's just the whole thing feels bigger.
Right, which can be concerning to men. Right?
I would
'Cause
guess.
It's like your testicle, my testicle feels bigger, doctor. What is it?
I guess. And it's different than the other one. Usually it's just one, would you guess?
Right. It's concerning, but if it's post-traumatic after an accident or something, that's usually a benign condition.
Just a swelling.
If it just grows slowly over 6 months, could be more concerning. So, and then on exam, sometimes you can't feel the testicle with a hydrocele because it's tense. So you do have to get an ultrasound to look inside because you can't feel it.
I'm going to be looking for that now, right? I am.
We'll talk about whether you should look or not because that's a very political thing to do with the USTPS, the Preventative Task Force, does not recommend that we examine ourselves down there to screen for cancer.
Really?
Yeah, we can have a little discussion about it when we talk
go
about cancer.
I'm going to get that.
So
Okay, keep
benign,
going.
but concerning to the man, and usually another thing you can have is a cyst coming off the epididymis. There's little ducts that conduct the sperm from the testis to the epididymis, and one of those can have a diverticulum or a bud coming off of it, and it forms a mass, like a teardrop-shaped mass above the testis.
That big? I mean,
Yeah.
Really? Okay.
And that's called a spermatocele. So that's a sperm seal or a sperm sac.
Okay.
They're little, so those are filled with sperm. Hydroceles are filled with water or transitate fluid, right? So those are very concerning because they do expand. But if and it feels like your testicle is getting bigger, and it can be firm. It doesn't get infected. These generally don't get infected.
Is it feel like a bump on my testicle? Yes. It doesn't feel like just some other floating thing. It feels just like a bump.
It's attached to it.
Okay.
And it can be very concerning for men because it's a lump off the testis. It doesn't hurt, but it's firm and it's concerning.
And is it concerning?
Not for me.
Okay,
no,
that's what I mean.
No. So I did a paper on this.
Right.
There are only a handful of papers on spermatoceles, but my concern was I was noticing, then we're coming in to the office noticing this, but by the time they noticed it, it was 4 or 5 centimeters.
What?
About that big. And I said, this is concerning. So are they denying it, or are they not looking, and all of a sudden they notice it and come in? And so I did a paper that's called When Does Size Matter for spermatoceles, and published it. And we did ultrasounds at the time of presentation, and the conclusion was men will come for care when a mass in their scrotum becomes the size of their testicle, which is about the size of a testicle. And that's concerning.
Yeah, guys.
because you don't know what it is.
Yeah.
And it's as big as your testicle. You have 3 testicles now.
Yeah.
And you're coming in for care. And thank God it's benign, and you may not do anything about it. But both hydroceles and spermatoceles, you can fix them surgically. That's definitive. There's other ways to go. But draining them doesn't work. They come back. But it is concerning. And this bothered me about the state of affair of men's health when we realized that men are either in denial or aren't looking there. And this thing is growing for 6 or 8 months. And that's enough in most cancers to be metastatic or spread. So that changed my view of things about men. It's like we need to raise awareness here about this. This is 20 years ago. And they're not looking. And that's so we can bring in the task force. The USTPS is a preventive task force, makes recommendations on what doctors should do based on the available evidence. And for the last 15 years, they recommended that men don't examine themselves down there for testis cancer. They don't screen with self-examination. I teach self-examination to everybody I can.
Yeah.
And it's because the statement is it's too much anxiety and it's unnecessary procedures. So at a population level, you're looking at lots of ultrasounds, most of which are negative. But I can tell you this in my practice, and probably every urologist that I know, 1 or 2 cancers a year come into the practice with a man saying, I don't know, it feels uncomfortable down there, heavy, and I'm noticing something. I'd like you to look at it. And it's cancer. And they're detecting it earlier than anybody. And that bothers me. So there's a group of us who are really, they want these recommendations revisited.
Good.
Now, cancers are really just 17 to 37 is kind of the peak for men. Okay. So you said, should I examine myself? You're not going to, cancer's the only worrisome thing there. We talk about penile cancer a little bit, but this is why 12,000 testis cancers a year. It's that age group. It's the most common solid tumor in a young man.
Okay. 17 to 37.
It's sort of the peaks. Yeah. So there's another peak in the 50s is much less. But so it's not, and it's very curable. And so their other point is, well, if it's so curable, it's okay to catch it late. And our point is there's a lot of stuff that happens between early detection and later detection, including chemotherapy, quality of life, potentially impact on fertility, and other things, job, productivity. It's a cancer.
Yeah.
Right. And it grows quickly.
Are they just saving money because they don't have to do all these sonograms and do all this non-needed medical attention to them? Is it also that it causes a fear in men and it will cause some sort of thing where men are just like worried about getting testicular cancer all the time because you're telling them to check for it?
They just say there's a lot of anxiety and that's not worth it. But there's not a lot of data. So the group of urologists and fertility specialists are really asking for a re-examination of the data because
they should.
It's not evidence-based recommendation. We think it's more of an expert opinion. And because it's a rare condition and it's very curable. All right.
Symptoms, things that we can be looking for as we self-test and how
So that's spermatocele, that's hydrocele, and then another one is called varicocele.
Okay.
And a varicocele are veins in the scrotum that come down like this.
Yeah.
So varicose veins in your leg
are
like varicose veins in your scrotum, and that occurs in about 15% of men. And these are just veins that the blood is supposed to drain up to the kidney, but we stood up as a species. When you're an animal and you're draining testicle to kidney, you don't need gravity. There's no gravity. But we stood up about 500,000 years ago. Not a great idea. So now it has to drain uphill. That vein has no valves, and it pulls around the testicle.
How does it show up? It's
kind of wormy. A wormy feeling
like a
under the
varicose
scrotum.
vein.
Yeah, wormy feeling under the scrotum, and on the back, and it can be painful.
Okay.
And it's a bothersome sort of heavy, congested feeling, never sharp, but just sort of heavy. And it really happens at the end of the day when you're standing all day, and that blood is going down. The other thing you can do is cause infertility. So it's the most common cause of low sperm count. It's the most common correctable cause of male infertility, because you can stop that from happening by doing surgery and tying off the veins so the blood doesn't go to the testicle and heat it up, because the blood's coming from the body and it's warmer than it should be, heats up the testicle, and that is why it causes infertility. So for our fertility, the worst thing we probably could have done is stand up as a species.
Really?
The best thing is probably the opposable thumb, which we got.
Yeah, out of it.
Not a great idea. Those are the big ones.
Those are big.
There's also hernias that can occur. So those are up here.
Yeah.
And typically those can be painful in the groin when you're doing activity, and that's bowel or there's a hole in your abdomen where your testicle and the cord comes out, and the bowel can join in, and you can examine that and feel it. Very common.
Yeah, very common.
Usually not worrisome, but if it hurts, it could be, and the risk is the bowel can get stuck in there.
Right.
And then you get what's called incarceration of the bowel. It's kind of a cool term.
Yeah.
And that requires emergency surgery.
Yeah, it's very painful too. You'll feel it. So
the emergencies here are going to be, could be, but not really. Epididymitis is an emergency somewhat because it's an infection.
Okay.
And you have to treat it. So this can get infected. If you're young, an infection in that organ is usually due to an STD. A sexually transmitted disease. If you're older, over say 50 or 60, it's usually a bug from the urine that comes down, and it's usually because of a urination issue.
Okay.
So you treat them differently on the age. And the most important emergency, which is you don't even think you go, is if you twist this testicle, because the testicle sits on a cord like that, and it can twist this way.
Okay. That hurts, I would guess.
So 720. Is an emergency.
Okay. How does that happen?
Depends, but there's so they twist all the time. You can roll them around, but not twice. And then this cord becomes wrapped, and you can't leave. The blood can't leave.
That's emergency.
Right. That goes up, and usually you have a heightened testicle with a thick cord. And it's very painful, and you can buckle over with it.
Okay. So I would say pain right now. It sounds like pain is a good indicator that you have an issue. Like everything you've said that is the most important feels like it is.
And that's the most common presentation for most of these things is heaviness, discomfort, because this is filled with fluid and it weighs a lot.
Yeah.
So you notice a weight change, or when you're running, it's jostling and it feels heavier. Dragging sensation, heavy, like there's a rock attached to it kind of thing. It's not really kidney pain kind of thing, right?
No, I get it.
But if your some testicles, instead of this entering the top, it enters the middle, and that's called a bell clapper deformity.
Okay.
Like a bell clapper and a bell.
Yeah.
And if it enters the middle, it's very easy to twist this way.
I see.
And so on exam, you can see who's at risk for it.
If it's a twist, it's an emergency, but it's different. It's an emergency just in the moment. It just needs to be retwisted. It just needs to be untwisted.
Or removed.
The whole testicle?
Yeah.
Holy smokes.
So you get 6 to 8 hours.
Oh, you're serious. You have 6 to 8 hours. It would be really painful then. Get to a doctor. If you have 6 to 8 hours or what?
If your pain starts, typically if you wait a day with this pain, and it can be epididymitis or this, you'll probably lose your testicle because it's dead by that point, and you have to take it out. If you can get within 6 to 8 hours, you can untwist it.
Okay. Never heard of this one before.
Surgical emergency. If there's acute pain, you're normal and you hurt, if after an injury or just after sleep or whatever, you call a doctor and you get in there. And they'll do an ultrasound pretty quickly, like that's fast. And you can normally save them and they'll be fine, but you can lose them.
All right.
Epididymitis, you typically won't lose your testis. It'll just be an infection that'll hurt for a couple of days. Now, cancer's the bad one.
Yeah, let's talk about testicular cancer.
So we talked about screening for it, but that's very subtle. Typically, it's the testis, which is the only organ down there that's going to cause problems.
Got it.
And it's typically a painless lump.
Okay.
And most people think, that it's going to be, you're going to feel a bump or something. Normally you don't. This might be normal for a testis, and this would be cancer.
Really?
So it's very subtle. It can be very subtle. So typically it'll be larger.
Okay.
It'll be enlarging slowly, and it'll feel more firm than a normal testis. It's not usually a lump on it. So the way I tell parents to screen is that you feel around the whole testis, should feel like a silk glove.
Yeah.
There'll be an epididymis there, and they'll notice that first. There's a mass, but that's just a comma-shaped organ around the testis.
Yeah.
And so that's important to know, to get that baseline. And I'll just say, you're normal today, find a change. Find a change. If it changes from, examine yourself today, because you're normal. If it changes, and that usually is size and feel. And I said, just give it a little squeeze.
Yeah.
And you can feel, if it feels more like that than this,
good.
That's concerning.
All right.
Now, testis cancer is, it's not that common, but it is common in young men, 17 to 37.
Yes.
And it's very curable. Testis comes out.
Okay.
And 95%, 99% cure rate. It's a complete success story in the realm of cancer treatment, because Einhorn in Indiana came up with, and they have dialed in the chemotherapy and they've dialed in the treatments so that it is not only curative but preserving your fertility. So
Wow.
it's Nobel quality work
Yeah.
in terms of cancer, of curing men.
Okay, so I get testicular cancer, or I feel a lump, something's not right. I go see you. You tell me it's testicular cancer.
Well, I'd usually probably get an ultrasound.
Right. Okay. So
But I
get
would
an
be
ultrasound.
highly suspicious.
Down the line. you
There's
get an
tumor
ultrasound.
markers.
Okay.
So you get blood tests, the alpha fetoprotein and beta HCG are tumor markers for different kinds of testis cancer. And then you would proceed to take out the testis and the cord, the whole thing, at a surgery, get the final pathology, then do scans of the rest of the body. And it's staged like other cancers. But it does move quickly.
Yeah. Okay. That was one thing I was going to ask. Is it,
You know,
how long
cancers
does it
like
take?
testis cancer will double in size every 3 months, like breast cancer or
Okay.
colon cancer. Prostate cancer is very different. It takes years. So this is the one you chase. It's very curable and quality of life. And I'm the godfather of the implant, so we can put a fake one in there and you never miss a
Balance
beat.
you out.
Yeah.
So the one testicle that's left is going to be, assuming everything's fine. So usually it's
Good
just
point.
one, not two. Usually it's just one.
Can be. It's called synchronous or metachronous testis cancer when they both have it. So the risk factors for this are basically age, family history of testis cancer, or undescended testicles, which is a common birth defect where your testicles don't go all the way to the scrotum when you're born, and they may come down a year later, or you may need to surgically bring them down. It's about 1% of boys.
And that has been linked to testicular
Yeah, those
cancer?
are higher risk. Yeah.
Okay. All right.
And I worry a lot. This is all me now. I worry a lot about pot use and testis cancer. I wrote a couple blogs on this 10 years apart, highlighting big epidemiologic studies that show the risk of testis cancer in heavy pot users is higher. And this is my biggest concern about pot, actually, in young men.
Wow.
I don't know. And, you know, it may not be considered fact in my lifetime, but
Yeah.
I'm worried about these associations.
I'm going to nod to the guy that does nothing but work on balls all the time. I mean, like you know that better than anybody. Are there other theories out there for things that we do, or the pollution or anything that's really less correlated and more causal for men's testicular cancer?
My research over years has shown that if you're infertile, you're more likely to develop testis cancer. So there's probably genetic underpinnings that have to do with the ability to repair your DNA. So young men with severe infertility were not repairing their DNA as well as men who are fertile, which is the two-hit theory of cancer. The first hit is you have a mutation, and then normally you would repair that mutation like a dent in a car at night, and then come out the next day looking good again.
Yeah.
But if you can't repair that dent, it keeps going, and that's the defect. So
All right.
these men had infertility, which is the first sign, and then prostate and testis cancer later in life. So I think there's, especially testis cancer, it's an early age cancer, right? So it's probably got a genetic component to it. You know, there's a lot of genetic components to breast cancer and now prostate cancer, and they're sort of all looking like the same gene sets.
Yep.
There's a certain number of genes, and it all are these ability to repair your DNA to live a long life kind of gene sets. So there's going to be a lot coming out.
Okay.
So I want to back up a little bit and go to the
Please.
penile cancer, which is the other cancer we're going to talk about.
Yeah, sure.
So we talked about benign lesions of the penis, but penile cancer is also a little tricky. A couple things about it. It usually only occurs in men who are uncircumcised, so you still have the hood.
You told me this maybe on like our second episode. You were saying that the only people that get penile cancer are those that are uncircumcised.
Right.
We will do another episode sometime down the road that's just circumcision episode, right? But that is a fact that I think not a lot of people
Right.
have
So
heard.
the biggest risk factor is an unclean penis.
Yeah.
And it's called smegma, and that's the white secretions that occur typically behind the hood, behind the glands, the crown of the penis. Non-hygienic penis with a foreskin is the highest risk.
Okay.
If your foreskin is clean daily, your risk is the same as a man who's circumcised. So there's really no risk.
Yeah.
And so that collection of fluid behind the testis, behind the penis, under the hood, that's called smegma, is a risk factor.
Okay. And
It's
so
probably prone for
what do we do if I
typically
see
the
that?
cancer occurs in the area of the glans penis, that the crown of the penis, that area.
Yeah.
There's other conditions we didn't talk about too much. One's called balanitis, which is a beefy red coloring, sort of like jock itch on the shaft of the penis. Also only occurs in uncircumcised men. And that is fungal. So it comes on suddenly, it's beefy red, it may be itchy, you put an antifungal cream on there, it goes away, keep clean and dry, and it's under control. So diabetics get it, uncircumcised men can get it. But if that beefy red thing takes time to happen and then stays there, that's more concerning for cancer. So velvety red lesion on the penis that's recalcitrant or refractory, doesn't go away, needs a biopsy. It's very rare, it's 1,500 cases a year, but it is not a good one to have.
Oh, jeez.
Things have to be removed.
It's when we go to things need to be removed. That's an issue. I mean, I don't want to remove things.
I mean, there's preventative medicine here.
Yeah, that's
It's
what
like,
you're just saying.
Take
It's clean.
care of your penis. Men with phimosis cannot pull the skin back, and I say, pull it. I examine them. I say, can you pull it back? And they go, and it goes halfway.
And it hurts, or it just doesn't.
It doesn't stretch enough. Right?
Yeah.
And you have to remove it if that happens because you can't get it. And I say, how do you clean your penis? They said, I just pull it back and let the water go. I said, you need to take a Q-tip and get in there and get it done. And I've had men pull it back, and there's like you can just see the tip of the penis. And I've taken them to surgery because they can't pull it back, and it's adhered or glued to the penis, and it takes a couple of hours to get that skin apart and get it back. And it's big surgery, but it's protective because you're collecting the smegma underneath there. So this is preventative care now.
Sure.
This is getting rid of a vicious cancer. You can cure it. You can prevent this disease.
It's a controversy. I get it.
Circumcision is a big one. I mean, San Francisco put an assembly bill out saying that, if you can't circumcise a young person, it's considered a crime.
Yeah.
And I wrote a blog called I Guess I'm a Fugitive.
Yeah.
But I do it in adults, and I do it a lot, and I do it mainly for medical reasons, but I do it for different. But for me, the hygiene alone
That's what I'm
is
trying
a reason.
Yeah. Look, it's just hygiene.
Circumcision prevents HIV. It prevents herpes. In Africa, everyone was wondering for years about how is HIV spreading so fast in Africa? And I was there for a while as a medical student, and I thought it was mosquitoes, and I got bit, and I thought, oh no, I'm dead.
Right.
And it wasn't mosquitoes because it doesn't last that long between bites. The virus. So I realized finally it was heterosexual sex. It was the main reason. And most African men are not circumcised. So I don't know where it started from, but they thought circumcision could prevent it. They put a circumcision campaign funded by our government, NIH, and they closed the study early because it was so protective at preventing transmission of HIV and then herpes and then other things. But the problem is it's a different culture, and you can't get the Maasai warriors to do a circumcision for that reason.
Sure.
Like, it's hard to convince them after thousands of years to change their culture.
We're trying to do it with Americans that are driving Teslas and that are right. Like, it's just saying
First world,
they need to clean their penis.
You have to
It's
do it
hygiene.
daily.
And okay, I get that it could be religious.
Your
and
teeth,
circumcision.
your penis.
Your teeth and your penis.
Your penis.
So we're going to keep moving here.
Yeah,
I want to. So number one, let's talk about fertility and how it is affected if I have lumps and bumps. Where is my fertility risk?
So the risks of lumps and bumps of fertility is cancer and varicocele.
Okay.
Really. Spermatoceles don't do it. Hydroceles don't do it. Hernias really don't do it unless they're big and they're in the scrotum. If you have a testicle removed,
You can still be fertile.
yeah. So there's reserve in the system, like other parts of the body. And if you remove a testicle, the data is that if on other circumstances, most times you're still as fertile as you were. Your sperm count's lower, but you're still as fertile as you were. And I get called into court a lot of times, like, this man lost his testicle to a hockey puck and we're suing because his fertility is half of what it would be. And it's just, no, it's not. There's a lot of reserve in the system. Same as with ovaries. You take one out, you're not half as fertile. It's very interesting. So there is reserve in the system.
Do you recommend before you take that testicle, while you're in there doing surgeries and stuff, are you also trying to find sperm and freeze it for them? Or is
You can. So some men present with testis cancer, and there is the testis with cancer, it comes out, and the other testis isn't working well.
Yeah.
And they might have zero sperm.
Okay.
So two approaches there would be oncotesy, which means take the testicle out and don't have it leave the room
Yeah.
Have the pathologist come in and paint it for markings and stuff that do, and then open it up and then do a microdissection testicular sperm extraction on the back bench
Yep.
and try to get sperm before you send it off to pathology.
Yeah.
And another way is to come to me afterwards and do mapping of the
Yep.
testis,
Yep.
where I would look at the other one and usually 2/3 of the time we can find pockets of sperm for fertility after that, even though there's one missing.
I'm just thinking of like a value of a 2-for-1, right? If you're going to be in there, I like that you're taking it on the side and seeing if we can go ahead and get sperm too, if that's where my concern is. So it's very practical. I would say a lot of the times when I talk to you about these things, and I assume it's convoluted and you went to school for a long time and you've got like, there's things to know. But what I'm hearing is the simplicity is there. It's simplicity. We take it out and then, and we work on it. We put it back in. And I'm just saying, I'm very impressed by how simple some of the procedures are. Simple.
They're not all that simple, but you can talk about them.
I get that it takes more than that,
yeah.
but it's like just thinking in terms of, common sense.
One of the things I was pioneering in as a professor was men with 2 testicles, both with cancer at the same time. And you want to preserve the fertility of young men. And so at the VA and elsewhere, we were doing enucleation. So we do ultrasound.
Yeah.
And if they're small enough, and Germans were really good at this, there's a lot more testis cancer there. They would do an ultrasound, stick a needle in it, and then target that and do a targeted enucleation and just take the tumor out, leave the testis remaining. So you save. So if you have one testis and one's missing, and that has a small tumor in it, you can catch it early.
Just get the tumor.
And then you can potentially freeze sperm after that, maybe in the ejaculate, and then irradiate the testis, and then it still makes hormone, so you don't have to lose both. So very creative, partial orchiectomies, enucleations, but there's criteria where it works and it doesn't. But I love that kind of stuff.
Okay, so we're going to kind of start to wrap it up. I want to go through a journey of somebody. They're in the shower. We're encouraging them to self-exam.
And that's a good idea. Hot shower. Things hanging low. Best time to do it.
A lot of guys are feeling it down there during the shower.
The intimate partners of men and men find more testis cancers than doctors screening them.
See, it's just practical information.
And that's what the USTPF does. It's like, it's really at home where these
partners
things are found.
notice it.
Absolutely.
Your balls are getting a little bigger there,
I would
sir.
say half the men who come in with concerns, it was my partner noticed this and here's what we found, blah.
Yeah.
And then it's like, can you help us out?
Okay, so I have self-examined or my partner has said something. I felt a lump, and now what? Right? You're saying, what is the nature of the lump? Is it painful?
Well, I would
like
go to a doctor for sure.
Okay.
I would not necessarily go to urgent care. If it's painful and you have a fever and it's clearly an infection, I would do that.
Yeah.
But they don't know a lot about dermatology. They know a lot about STDs, and they're going to do an ultrasound, and that's really only going to be for the testicle. So they're going to miss subtle things like varicoceles and things like that.
Got it.
But, and it's expensive.
Yeah.
But a primary care doctor would be good with an ultrasound. I would probably do it without an ultrasound for most of the things, right? Mm-hmm. So I don't need that because that's all I do.
It's nice to have a friend that is a reproductive urologist and can say, hey, I just give you a call and say, hey, if I was concerned. But not everybody can do that. And so and insurance sucks, right? And so I want guys to catch it quick too, right? And I do know that pain is one. And yes, we feel for abnormalities. That's 2. I go see my doctor. If they're concerned, they're going to refer me to somebody like you, I'm guessing?
Oh, sure. They would go to urologist probably eventually, or a dermatologist if it's skin. I wouldn't go to Dr. ChatGPT and I wouldn't go to Dr. Google because it'll always go to the most severe things, which are the rarest. But that is where the anxiety comes from.
Yeah, that used to be a WebMD thing. Remember when WebMD first came out and be like, oh, I'm feeling this. I go and I look and it says I'm dying of cancer. It just was always depressing, and this is the worst case scenario it felt like. And then, people get anxiety. In my 50s, I will say, if I feel something that's different, a sharp pain, I'm like, oh, what is that? I mean, I do. I have...
pay attention to your body.
I pay attention to my body, but I have anxiety around it too as I'm getting older.
So the argument from the task force nationally that it increases anxiety, you could get rid of that by just calling a provider, right? So one way is just act quickly, get it checked out. you can go to urgent care, that's fine. But that's the way to get rid of anxiety, is to know more, not delay, or it must, fester with it. Like these guys for 6 months or 8 months finding things in their scrotum the size of their testis, which is very concerning. That's a behavior that I've always been concerned about.
Yeah, it doesn't make any sense. I don't know.
We need an Office of Men's Health.
There
we
you
need
go.
someone
Thank you.
to put power into this and say, guys, you go here.
Because it's not just physical, it's mental. We're saying there's some obstruction in their brain that says this thing that's growing that isn't normal, I should get it looked at. And this is totally on a different subject and about dermatology, but on my Facebook feed or my Instagram feed, I get the Dr. Pimple Popper, right? those are like, people are into that. But then I see it's like people have these tumors and these growths and these cysts that are, like here, and it's this big, huge sac, and they're hiding it with their hair. And they're just, the reason they don't get it taken care of is because they don't want to find out they have cancer. Right. That seems to be This
is the classic for penile cancer. I was at the VA hospital. Uncircumcised men, these things are not subtle.
Yeah.
Head of the penis is replaced, and they've had it for years, and they just will not show up. And they know it's bad. It's worse if you don't show up.
Yeah, there's something about men too, like just cut it off and we'll go on, or it's not a big deal and we go on. It's like, how about a little self-care, right? You're going to lose the top of your penis someday.
If it's something on the penis and it's not changing, there is penile sparing surgery, like Mohs surgery for your nose for basal cells. And
sure.
You can do scrapings and get stuff done. It's very innovative.
Yeah.
But you got to get it early.
Okay. We're advocating for men's health.
Yes.
What did you say? We need an institute what would you?
Office of Men's Health. It's one for women. We need one for men badly.
Thank you. Very much so. So look, you're not going to sit around the pub and talk to your boys about your abnormal growths on your right testicle. That's not going to happen, right? But you need to be aware. We're trying to get the conversation going to the people that are listening, that men are people too. And we need to catch this early, more self-examination. Go see a doctor if you're feeling pain or you feel a lump that is abnormal. What's some other just good advice as we kind of close things out?
Persistent pain down there, anything that's changing. Mm-hmm. Skin is pretty easy to see, but and the monthly exams in the shower should happen monthly.
Sure. Monthly exam.
And you want to feel a difference from the last month. You're not responsible for finding a mass on your testis, right? Mm-hmm. But if you know it's 1 month it feels this way and it feels a little different the next month, that's a signal. That's an early sign that you should get it checked out.
Well, this has been such a fun episode. It's fun in a way that we're talking about things that aren't usually talked about.
Very rarely talked about.
Right? And so tell your friends and neighbors. Have them follow us on Talk with Turek.
Watch this episode.
Watch this one because there was literal visuals. The teacher sat here and showed us exactly where we can be looking for. Follow us on Talk with Turek at YouTube, on Spotify, anywhere you get podcasts. Like, subscribe, tell people about it, comment, leave us questions in the comments.
Yes.
If you have any questions that are specific, hey, what happens? It hurts when I do this. Paul will come back and say, well, don't do this.
Your best asset in life is your health.
Thanks for joining the Talk with Turek podcast with hosts Paul Turek and Rob Clyde. Talk with Turek is produced and recorded in South Pasadena, California, in association with Galaxy Media Ventures. Executive producers are Jennifer Harris and Rob Clyde. Today's episode was produced by Max Flora, engineered and edited by Drew Unser. For more information or to book an appointment, whether in person or virtual, visit Dr. Turek online at theturekclinic.com or call 888-TUREK-MD. That's 888-887-3563. Subscribe to our show wherever you listen to podcasts and watch us on YouTube at Talk with Turek. And thanks for helping us advocate for men's fertility and sexual health.